So I see people joining as we speak. Good evening, everybody. My name is Timmy Frawley. I work in University College Dublin. I'm joined here this evening by colleagues Ken Kilbride, CEO of ADHD Ireland, and Beth Kilkenny, who is a senior projects manager in UCD as well. And also, I'm very pleased that we're joined by Victoria Sweetmore. And just to introduce Victoria, Victoria is a mental health nurse, and she's the head of mental health and learning disability nursing at the University of Derby. She worked clinically in a range of areas, specializing in urgent and acute care. Now in an academic role, her research interests include mental health nursing within a historical context, and she is currently working on her PhD, which aims to examine mental health nursing's development as a profession since the closure of the asylums. Victoria has also written about being diagnosed as autistic as an adult, and her reflections and experiences around this. And as some people watching or listening may know, I am a mental health nurse myself. So when I read Victoria's paper in the Journal of Psychiatric and Mental Health Nursing, I was really, excited to read it. I really enjoyed it. But I also felt it would be very, very useful for people to hear about your story, Victoria, more widely. And also, I guess, being parochial about it, to see mental health nursing and mental health nurses coming to the fore was exciting too. So the session is being recorded, just to say we do that so that we can circulate it to people who've registered and who might not have been able to make it. So as per usual, if you have questions, you can pop them in the chat and we will work through them after Victoria's talk. Just to get an unashamed plug in, next month in May, at the end of May, I think it's the 24th and 25th, we have our free conference, Neurodiversity Shifting Paradigms in Mental Health. So it's a virtual conference, Thursday the 25th and Friday the 26th of May. As I say, it's free. People can attend all of it, or they can attend parts of it. And if you wish to scan the QR code or go to our website, you'll see a range of exciting speakers on a variety of mental health topics. And actually, for our masterclass next month, we will have a panel discussion exploring neurodiversity and mental health in education settings. So if you're interested in mental health, and if you're interested in neurodiversity, and if you like free stuff, I think this could be a conference for you. So without further ado, Victoria, handing over to you. The floor is all yours, and thank you so much for joining us.
No problem. Thank you very much. Okay, so I haven't prepared a presentation as such for this, so I'm afraid you're just going to have to watch me speaking for the next little while. Obviously, I was asked to do this because of the piece that I wrote, which was in a journal which is really pushing for generally for lived experience narratives. The idea being that if we can get these pieces written, published in peer-reviewed journals, so it still goes through a peer review process, it just helps use lived experience generally as part of kind of academic discussion and debate, which has been really positive. And it's so that's sort of how it came about that I wrote it and got it published. And it's been really interesting since I got it published. People do just come across the article. I'm guessing sometimes because I'm obviously one of the senior leadership team in my own work, so people sometimes look me up and find it. I've had parents at school who've sort of said, oh, the children were Googling each other's parents at school in ICT, and my daughter came across you. I think that's what they do in their ICT lessons, Google each other and then Google their parents, and people have found it that way. I was in a meeting the other day and about something completely different, something very operational, and somebody said to me, oh, are you the Victoria Sweetmore who wrote about autism in women? And then we had a long conversation outside of that, because he'd also just been diagnosed. Obviously, he's not a woman, but he'd just been diagnosed at the age of 60. So it's been really nice to kind of connect with different people through that, and that people have read it. I mean, that's one of the things with when you publish anything in an academic journal, is how many people actually read it and access it. I was also really bizarrely invited to go and speak on Steph's Packed Lunch, which is a daytime, I don't really know, a daytime TV show where they do all sorts of, I don't know, cookery, and they have guests and things. So that was an interesting experience as well. I think I had about 5 minutes of fame, and went and spoke about, like, you know, what my experience is. So yeah, it's been an interesting time since I wrote it. It's a couple of years since I wrote it now, and it was actually something that I just wrote one afternoon when I was sat at home, and yeah, wrote it one afternoon and submitted it, and then you know, got it accepted and published. So it's I'm pleased that I did, and it's been, yeah, been a good experience overall. So what I was going to do was just kind of talk a little bit about myself, which is partly why I haven't done a presentation, because it felt a bit strange doing a presentation about me, and my experience, and how I suppose that sort of shaped and affected me. If I kind of start thinking about, you know, back in my childhood, so I was born in 1982. So in the 80s, well, really up until quite recently, autism, it certainly in girls and women, wasn't really something that was considered. You know, it didn't really exist in terms of being diagnosed. I was certainly always an odd child. I preferred the company of adults. I found children a bit boring, and a bit very difficult to understand. I didn't really have anything, really understand why they were interested in what they were interested in. I kind of had quite a rich imaginary life that I'd kind of created. So I had imaginary friends who I'd called my brothers. So I do have a sister, but she's nearly 7 years younger than I am. So at this time I was an only child, and so I created a group of brothers that I hung out with. Didn't have many friends. I really only had one friend, and that was quite difficult. I did have quite a range of interests. I loved animals, I still do, but I absolutely loved animals, had lots and lots of books and magazines and pictures of animals all over my bedroom. The other thing that is quite different, I suppose, about me is I do not remember a time in my life where I couldn't read. So when I went to school aged 4 or 5 or whatever it was, I could already read fluently, and there is no time within my memory where I couldn't read. So I was reading Roald Dahl books and Enid Blyton books, stuff like that, I suppose, at sort of the age of 4. It's subsequently found out it's called hyperlexia, where you have that sort of reading ability, and it's something that I actually didn't realise that everyone couldn't do until I was well into adulthood and had my own children, and had to teach them to read. I hadn't realised that that was a thing that I was going to have to do, and it was something I found really frustrating, because I thought just everybody could read. So that was a bit of a shock to me. But that was a big thing when I was a kid, you know. So I knew not everyone could read as well as I could, but I didn't realise, yeah, it was a thing that other people had to learn. I had mixed kind of experiences in school. When I was very little in primary school, I went to a very small village primary school. We only had there were about 20 pupils in the entire school. So we were all taught together. So it's a bit of an odd experience anyway. And we had a very, again, obviously I was sort of a small child, but a very elderly headmistress, and I think she was very elderly, with some quite odd views. So it's all very difficult, and I remember always struggling in that school. And I didn't really, I really only had one person I would have called a friend, and even that was quite difficult. And then when I moved to a middle school that was bigger, that the people there had been together since sort of foundation year, since primary, since, you know, reception year. So again, really only had one friend there, very much struggled to kind of fit in and find my place within those social circles. I would quite often have run-ins with teachers, and I think in the piece I wrote, I've written about the dinner lady, who I used to have constant run-ins with. Classroom time is one thing, that's all quite structured and organised, and, you know, there's generally a pretty clearly defined set of rules around how you behave at lunchtime, whereas dinner times, I very much struggled with that free time, and learning and understanding and interpreting how I was supposed to behave, which quite often meant I'd be punished. They used to make you stand against a wall with you facing the wall, or she did, and it was all. It was. I always felt very hard done by. I suspect that she probably thought that I was just difficult and causing problems for the sake of it. So very difficult. And secondary school wasn't a lot better, although secondary school was bigger and had a library. So I spent a lot of my time in secondary school in the library. And I had one good friend who is still my friend now. And, you know, so she was my best friend all through school, and continues to be one of my best friends now. When I did move into secondary school, as I got older and things became more difficult, that's where I began to experience sort of some mental health difficulties, which I suppose, again, we're talking mid-90s, so mental health wasn't spoken about in the same sort of way. But I was always introverted, but I became very introverted, quite anxious, quite depressed, began self-harming as well, and really, really struggled, you know, as I hit those sort of key teenage years, sort of around 14, 15, and other people were having relationships, and I didn't understand how any of that was supposed to work, or really actually why anybody was interested in it at that point. I can remember going to see my GP when I was about 16 or 17, not with my parents, and she put me on antidepressants, which I really reacted quite badly to. They made me more anxious. They made me quite shaky. I think it was Prozac that she put me on. And it really, really affected me. And I can remember going back and her telling me that I was just basically being silly, and needed to keep taking them. So I stopped taking them and decided not to see that GP anymore. Then I went off to university. So I'd had, alongside all of this, I had quite a difficult time with my parents. and this is one of the difficulties with being diagnosed eventually, is that I also have quite a lot of historic trauma with my parents, my dad in particular, with sort of kind of emotional abusive type behaviours, and actually looking back now, I suspect that certainly my mum and possibly my dad sit somewhere on the spectrum, which doesn't really excuse it, but I think we all found it very difficult being together. So I went off to university and kind of continued, managed academically all right, and I always have, but continued to struggle with relationships, continued to struggle with my mental health. I met a partner at university. I was with him so I met him when I was about 18. Well, I was 18, not long started. Was with him for a long time, nearly 9 years we were together, and we actually got married, although we divorced not long after getting married. And I realised now I stayed with him for a long time when the relationship should have ended. And some of that is around not wanting to have that change, not really understanding what a proper relationship should be, and kind of feeling like it was my fault for not trying hard enough and doing things like that. So I was with him for a long time, up until my mid-20s. Also, while I was at university, at one point my mental health was really quite bad, and I'd self-harmed quite badly, to the point where I needed to go to A&E. And I went, and the nurse who saw me in A&E was very disparaging, and told me that there was no hope for me and nothing that could be done. So at that point, I was about 19, maybe 20 at this point. So I very much took that as that was it. There was nothing that could be done for me. So there was no point in me talking to anybody or doing anything or seeing anybody. And that carried on all through my adult life, kind of having been told that at such a time. So went through uni, did a degree in psychology, which I kind of look back on now, and I think that's very interesting. I think I picked that because I've spent my whole life trying to understand people. I think I quite misguidedly thought that a degree in psychology would help me. Perhaps it has to some extent, but I think that was where that came from, this idea that it would help me understand people, and how they act and how they do what they do. I did realise pretty much through my second year that I didn't really want to be a psychologist. I didn't want to go down that route. So when I left, I worked as a support worker for people with autism, and it's described as autism and challenging behaviour at that point. And I worked for a big organisation in a residential home for people they had quite significant needs. And I quite enjoyed that job, but realised I needed to do something a little bit more to get a professional qualification if I ever wanted to kind of progress. And that's how I ended up going back to university doing my mental health nursing. And again, it's that with mental health nursing, I think it was that trying to understand and make sense of things. And I think lots and lots of people who come into mental health nursing have their own lived experience of mental health difficulties, and I don't think I was any different in that respect. I think I was trying to make sense of my own stuff, and it seemed a natural thing to do. It was as I kind of came to the end of my nursing degree, I split up with he was my husband at that point, but split up with him. So we've been together about 9 years, and that was all quite messy and difficult, as these things often are. And then I met in my first nursing job, my first proper mental health nursing job. I met my husband, my current husband. So we always like to tell people that we met on a psychiatric ward. so he was working as a healthcare assistant and I was a newly qualified nurse. And that was I was about 27 at that point. So then over the years, we've both carried on in our careers. So he went and trained as a nurse as well, as a mental health nurse. We've had 3 children together, and have ups and downs within the relationship, like you do. But after the birth of our 3rd child, my mental health was really, really poor once again. And not for no kind of obvious reason other than at this point I've got 3 quite young children, but I was really, really struggling with everythhave I'd got at that point I was working as a band 7. I was a ward manager, so I got my children, we were doing okay, but just everything felt completely overwhelming. My mum had she died a couple of years previously, and that had been very difficult for everybody. So there was still some hangover from that as well. And as I was kind of sorting through all this, I'd begun, behaviour and things that I hadn't really done since I'd been a teenager. So I'd gone back to self-harming. I was really, really anxious and just distressed all the time. And I felt I felt like I wasn't a real person. I felt like there was something intrinsically missing from me. And I didn't know what that was, but whatever it was that all the other people around me had, and that I could see that they had, because, they were off having, being together with their friends and in groups and living their lives. And, like, as we know, people tend to do, you only see the best of what people want you to see. But I very much felt like I couldn't do that. And there was obviously something missing and something wrong with me that meant I couldn't do that. So I went to the GP and ended up being referred into mental health services, and ended up with the diagnosis of borderline personality disorder, which, as a mental health nurse, I am acutely aware of kind of the stigma and the difficulties that come with that diagnosis, but I could also appreciate that I did fit the diagnostic criteria at that point. So I got sent to something that I like to call PD Club, which was this 6-week, I guess it was sort of CBT based or DBT based group therapy session. That was one of the worst experiences of my life. I'm sure it benefits some people, but I found it absolutely horrendous. So there were these 1-hour sessions that I would go to with, I think there were probably about 10 or 12 people with diagnosis of personality disorder, where we would do, I don't know what we did. I can't even really remember what we did in these sessions. There was lots of flip charts and looking at emotions and stuff. Oh, what I do remember is when one session where they brought out, I don't know if people have ever seen it, an emotion wheel that has, so it's very brightly coloured. It had about 50,000 sections on it, with all the different emotions kind of listed on this thing. And I can remember looking at that and thinking, what on earth are all these? What are all those emotions for? Who has that many emotions? Surely you just need like a couple. You just need everything's all right or everything's not all right. I can remember being completely overwhelmed with this emotion wheel. But being a good patient, I was also aware that if I didn't participate and I didn't do it, then I would be labelled as non-compliant, and all the sorts of language that I'm well aware gets used about people who access mental health services. So I went and I did all the things, and I left, and I didn't feel any better. In fact, I felt worse, because I thought, I have done this course that's supposed to make me better. I'm doing the things, you know, I'm doing all the things I'm supposed to do, and I don't feel any better. So it's me that's broken, it's me that's unfixable. And that was really the worst time, because I couldn't access anything else, because you just have to go away and try for a bit. Yeah, I couldn't really see any kind of way out. And it was at that point really that I spent a long time on the internet trying to make sense and trying to find answers. And that's where I started coming across articles about women and autism, and how that was, how BPD in particular, there was a lot of crossover or misdiagnosis. And it was over weeks, if not months, of kind of reading and looking, because at first I thought, oh no, it's not right. But then as I spent more time kind of looking and building up my knowledge base, began to understand that, hang on, this is where I fitted much better with some of these things. And I spent a long time kind of going back through my my childhood, my adolescence and my adult life, and talking with my husband, and really beginning to kind of reevaluate and reframe things, and thinking, well, could this actually be that there's been some sort of neurodiversity going on here underlying everything else? And after a while, kind of concluded, yeah, this is what's happening here. You know, I do find it very difficult to understand what people are thinking or feeling. I find it very difficult in social situations. I get very anxious in them. You know, realize that I will often, I'd spent my whole time, you know, I wouldn't go into a social situation if I didn't know if I could have a drink. Not necessarily to get drunk, but, you know, knowing that there would be something there that I could have that would help to kind of calm me down a bit. Lots and lots of problems with making friends, and also retaining friends. Loads of issues with things like small talk. I don't really get small talk at all. I've realized I've never understood why we need to do all the stuff about if people have had a good weekend or whatever, because surely they'll just tell me if there's something interesting that I need to know. Like I say, obviously problems with expressing emotions and feelings. So yeah, there was lots of that, and I realised I also have a lot of routines and things that I like done in a certain way. So yeah, I kind of put all that together. I went to my GP again after there's quite a big gap between going to GP here. Presented all my information, and he said, okay, yeah, that's fine. What do you think having a diagnosis will achieve? Why do you want one at this point? You know, you're quite certain, so that's fine. There's no treatment as such, no medication for it. So why do you want a diagnosis? And actually at that point, one of the big things for me was, as well as struggling kind of in my personal life, I'd reached a point professionally where, you know, I was in management, I was having to deal with complex things, and I'd had some difficulties, without going into much detail, with my manager at the time. And I ended up leaving that role in what I now kind of look back on and think was probably constructive dismissal. And I'd moved into a new role, I'd moved into academia, and I was quite anxious about having that sort of protection with protected characteristics and the Equality Act. So that was a big thing for me, was having a actual diagnosis for that reason. So I went and I waited for 2 years and eventually got my my diagnosis. So it all happened, that was all during lockdown and COVID. So it was over Zoom. I did it all over whatever it is the NHS uses, which was fine. And actually, because it took so long, by the time I got it, it wasn't. Lots of people talk about kind of feeling really elated or you know, having mixed emotions or whatever. But by the time I got it, I think I'd had so long, I'd already worked through everything. I was absolutely 100% sure that I was autistic. And so it felt like, I remember saying to the person who did my assessment, because they always say, what will you do if it's no? And I said, well, if you tell me I'm not autistic, then I've failed in making you understand why I am autistic, because I absolutely am. And at the end of it's a 2-part assessment, but at the end of it all, she only needed to kind of go away for about 5 minutes to just deliberate and put everything together. And she was like, yeah, you are, we can confirm that today. And I'll send you a letter. And actually since then, it's just been so different. Diagnosis isn't for everybody. It's not the be all and end all of everything. And actually, in mental health terms, I'm somebody who's very cautious about diagnostic criteria and categories, you know. And if you talk about things like psychosis or schizophrenia, you know, depression, anxiety, all that sort of stuff, I'm much more interested in the symptoms and you know what it means to people. So it's quite interesting that I've kind of put so much into this diagnosis, but it just, you know, I'd done it because I wanted, you know, I wanted that sort of protection, I suppose, under the Equalities Act. But you know, it gave me validation, permission to kind of be myself. You know, people talk about masking, so it meant I could just stop doing that, or say to people things like, I know that I'm going to find this situation exhausting because I will have to perform, so I will need time afterwards to you know, to recover. I did realize how exhausted I'd been all the time, just constantly, through putting on this kind of facade. Yeah, and it meant I could enjoy the things, you know, suddenly that I'd suppose I'd denied myself. So probably, I don't know how well you can see in the back, but I absolutely love Lego. So, you know, that's something that perhaps 40-year-old women aren't supposed to be quite as obsessed about as I am. But I absolutely love it, and it's something I take lots of pleasure in now. But I wouldn't have allowed myself to do that previously, because you know, it's childish, or I don't know, weird. But I'm all right with that now. And yeah, I think having a diagnosis also means I can say I am autistic, and look, these other people agree. You know, it's not just me, and that's helpful too. So yeah, I suppose that's very quickly my story. I also wrote the piece because, as a mental health nurse, and as part, although I don't work clinically anymore, but as part of when I was sort of looking back on myself and my history, of course, some of that meant looking back over my professional life. I'd worked in I've worked in liaison psychiatry, I've worked in crisis teams, I've worked on acute psychiatric wards. Interestingly, I did work as a community nurse, and I hated it. I hated having a caseload and seeing the same people and having to do the social side of it. And again, I've realised that's because I don't like going to people's houses doing all the small talk stuff. Whereas give me somebody in a crisis where there's some immediate actions to be done. And I used to love talking to people in liaison and getting, you know, hearing their stories and then referring on. You know, so that's always what I've been drawn to. But what I do reflect on a lot now is how many of those people were also probably undiagnosed, autistic, neurodivergent, all those sorts of things, particularly the women that we would see who had borderline personality disorder diagnoses, who would come through, and actually how damaging that was. So that's really the other reason that I wrote it, why I kind of will talk about it, because I hope that it does help people think, well, actually, it's not, you know, autism, neurodiversity, all these sorts of things, they don't look the way that we always expect them to look, or we've been kind of taught that they look. And I think there's a huge number of people out there in psychiatric services, or accessing psychiatric services and mental health services, who are undiagnosed, who have underlying kind of problems. And particularly eating disorders as well is another area. So where there's lots and lots of people who they think have underlying autistic or neurodiversity, and the treatment options are targeted for neurotypical people, so can actually be quite harmful. And although it wasn't like eating disorder treatment I had, it was you know, that CBT, DBT type approach. I did find it very harmful, and it wasn't right for me. And I know lots of other people with autism struggle with some of those therapeutic interventions. So yeah, so I'm conscious I've talked for more than my half an hour that they suggested. So I don't know if we want to go. I can talk about myself for a very long time.
So, Victoria, thank you very much for speaking with us, and certainly we'd be delighted to hear you continue talking, because what you had to say was very engaging and very detailed and enlightening. And I have some questions, but of course, you know, we want to hear from the wider group of people who are listening in this evening. Maybe I'll just get the ball rolling with one question, and it's that piece about under recognition in women. And do you have any additional comments on what could be done, you know, to increase awareness of neurodiversity, specifically autism in women?
I think what's happening is a really good thing. So you're seeing things. So you've got people like Christine McGuinness doing her thing on the BBC about being diagnosed with autism. So you're beginning to get people who are high profile. I'm saying it like I know. I don't know who she is. I don't know anything about celebrities, but lots of other people do. So I think it's having kind of high profile people and getting it out there. Things like when I went on Steph's Packed Lunch, I mean, that's not something I would ever watch normally, but it means that it's getting out there to other people. And I think it is just people talking about it openly, how it does look in women. There's lots of research as well, and lots of things happening that I kind of hear about, where the diagnostic tools that are used are all very male focused, because that's traditionally how autism's been viewed. So there's moves to kind of make them, you know, to address some of those subtleties where, so another thing that I was really, I still am, although things like children and work take over, but I was reading like women often will be really, really obsessed with reading, whereas that's not really seen as an obsession or a special interest area. So I think there's some changes with those diagnostic criteria. Also things like the fact I'm married and have children, you know, that a lot of people still think, well, if you're autistic, you can't have a relationship. How can you possibly manage a relationship? We do now know, and he won't mind me saying this, my husband was then subsequently diagnosed with ADHD and autistic tendencies. And I've discovered nearly everybody in my small but perfectly formed social circle sits somewhere on a neurodiverse scale or thing. So yeah, so it's about diagnostic criteria, I think, on one side, but also about just awareness and people talking and it being in publicly accessible places.
And, you know, just to bring Ken and Beth in as well, but just while they're coming in, one more quick question. And of course, we know that there's lots of good things happening in the health services and indeed in mental health services. For example, you even referenced some of your own really good work, I'm sure, in liaison mental health and crisis intervention. But how can mental health services be improved in your view? What would have made your own journey more beneficial, I guess?
Yeah, I think it is that, particularly because at the time where I was really struggling, I was immediately channeled into that borderline personality disorder kind of pathway, is what I'm trying to say. And there was never any consideration given to any of the other stuff that was going on around it. Nobody ever asked me questions around the fact that I was saying I felt like not real. I felt like I was missing something, that I couldn't understand certain things. And I think that's because, and I know that it's because as mental health nurses, you're not trained to ask those questions. You're trained in a different sort of medical way. You're looking for certain diagnoses or certain certain things to fit people into. So we need to broaden that out. And mental health nurses are absolutely key to doing that, because they're the people who do all of the, you know, that initial stuff generally. And I think that's one of the ways. I think also generally now, neurodiversity, autism, we're seeing that it doesn't really fit properly within services as they're set up. So you've got services for mental health, you've got learning disability services, and autism, ADHD, all that, it's not really fitting anywhere at the moment. So we need proper specialist services and support, or proper integration into mental health services. That means, you know, more robust training for people who are there and who are going to come into contact with people. Yeah.
Okay. Thank you, Victoria. And Ken and Beth, just, yeah.
Well, good afternoon, Victoria, and thanks very much. I'd have to say, I mean, somebody put in bravo. I actually will put in the word brave. So thank you very much for putting in your story and talking about your experiences and your struggles. Just before we go to the actual Q&As, just a question just from myself. And you talked about your struggles and going through the process of getting a diagnosis. And it's like that for a lot of people with ADHD as well. But not looking at it from an autistic person, not looking at it from a one, but looking at it from the perspective of a lay person. How is getting the diagnosis for you? And then maybe looking at it from a professional perspective, on the basis of that perspective, how would you change things?
So I suppose the thing with getting the diagnosis, I can't really separate it from being a professional, because I understand how the system works. So I knew how to approach my GP. I know how to get a referral. I know what I need to say to, you know, to meet the right things. So in that respect, I think I massively benefit from the fact I work, or certainly worked within health services. So I knew how to just knew how to use the system, which obviously most people don't know, and it is difficult and complicated. And I'm in a few kind of groups about for autism and late diagnosed women or women with autism, and I see it all the time on there. People going, well, I've gone to the GP and they've said that it's rubbish, or they've said this, or they've said, well, it won't change anything. And I think that's really problematic. That it depends who you get on the day and what their level of knowledge is and all the rest of it. So although for me it was all right, that's because I have that other knowledge that not everybody has, and that's one of the things that I think is really does need to kind of change. And there's also a bit like my GP said, well, why do you want one? Because what are you going to do with it? But it is that validation. It is that, somebody saying, yeah, it's not that you're not trying hard enough, or there's something, wrong or broken or whatever. It's saying, actually, there is a thing, there is a named thing here that you can use as scaffolding to understand and make sense of who you are. So that's, that's one of the big things for me. I suppose the other thing is the waiting lists. So I knew that it was going to be a long wait. I did see a question come up where somebody said, did I disclose it at interview? So that my current job I'd already got before I went and got the diagnosis, but I did tell my manager at the time that I was on the waiting list. And then when I got the diagnosis as well, I've been very open with it. And obviously, it's hardly a secret now, but I've been very open the whole time. But the wait was difficult's not even the right word. Probably because COVID happened, actually, didn't massively matter, because all the things like I wanted time to work at home and to decompress. Well, now I have all the time to work at home and do those sorts of things. So it kind of got overtaken a bit by events.
Okay, thanks very much for that, and I really appreciate it. Before I quickly go to Beth, just stick in another one. And just at the very start of your speech, you were talking about your school experiences, and you had an older headmistress who you described with odd views.
Yeah.
Tell me more about that.
Oh, so she was very traditional. So there were things like, so because I could read is the thing I'm thinking about here. So I could read anything that was put in front of me, including things that I probably shouldn't have read as a child, but but when I went to primary school, I had to work my way through the prescribed reading list, process, whatever it was. So I had to start with The Ball is Blue, the whatever. So I had to read every single book before I was allowed to kind of move on to just read what I could already read. And I remember it, and it took months for me to go through all of these stupid books. And I can remember my mum going in and saying, what are you doing? But she was, who knows, maybe she was on a spectrum. She was absolutely rigid that I had to follow this process. And there were a lot of things like that. It was, you have to do it this way. I would guess that's probably a pedagogy from the 1950s.
I was going to say the 1850s, personally.
Yeah.
Well, thanks very much, Ed. I appreciate it. I think Beth has the next question.
Thanks, Victoria. Just to say, there's loads of comments in the chat here, just saying thanks so much for sharing your story. So you probably won't get a chance to look at them all, but just to say that they're there. So thanks for that. And just one question that's come in here about somebody who also works in mental health, who says, I believe there are many autistic service users undiagnosed and their autism is not recognized. Other team members will say a person is too high functioning, or because they are married or they have a job, to be autistic. So they obviously don't understand what autism is. How does this person help their team members understand that their understanding of autism is so wrong?
Okay, so I know that I think it's the RCN released a whole load of documentation around autism. It was around autism in registered nurses, for nurses. So it was one of the things, so it's there sort of saying, there are people who work as registered nurses who are autistic, and this is how you can support them. And I think sometimes recognizing that there are people working alongside us who are high functioning, if we're using that term. I know some people don't like it. I'm a bit ambivalent about language. It's whatever people want to use, really. But yeah, I think recognizing that there are lots of people that work alongside you who will be autistic or ADHD or whatever, is one of the steps towards perhaps saying, well, so also some of these people that we're seeing in our services, they could also be autistic. My husband still works clinically, and it's interesting because he often, again, because he's quite acutely aware of it, I know he's had cases where he's sort of said, have we thought about there could be some autism or ADHD or some other kind of neurodiversity here. And I know he's had some tricky conversations with medics in particular around, well, we could, perhaps we could look at it differently. And I think some of that as well is that there's not treatment as such for it. So because we as nurses and psychiatrists too, we like to do, don't we? We like to fix and make it, we want to be giving people something to make it better or to solve the problem. And that's not really how it works with neurodiversity. It's about understanding and that, managing it, taking time. So I think that's sometimes difficult for teams and people who work in mental health services to kind of square away. I think there is training out there on autism as well. There's that might be helpful. I think directing, it's sort of plugging away, isn't it? And saying that there's lots of people out there who are identifying as autistic or neurodiverse or whatever. Me and my husband like to call it neurospicy. So that's one that's come up. I've seen it written a few times as well. We like that. So I think as it becomes more kind of culturally accepted, then it will follow that, obviously other people that we see in mental health services are also going to have those neurodiverse needs. Yeah. So I don't know, I haven't really answered it because there isn't a nice simple answer.
Yeah, well, no, well,
just keep plugging away.
Yeah. If there was an easy answer, yeah.
Send them to me, I'll have a chat. Yeah.
We'll send them on the recording for this session. Yeah, that's a good idea.
Send them the thing I wrote. Yeah.
There's just a question here, which is kind of a bit of more of a personal question, and it's just about it. It asks if you're raising children who are also neurodivergent. So maybe you don't want to disclose that, but maybe you might just talk about your experience as well of parenting.
Yeah. No, I am happy to. I would have said it if I'd had more time, probably. So I've got 3 children. Our middle daughter is diagnosed with autism, so she has an actual diagnosis. And she is a very typical autistic girl in that you will see great at school, follows all the rules, comes home, has an absolute meltdown about it, really struggles with some of the nuances and things. She's 11, just about to go to high school, so lots of transitionary stuff, and that's difficult. And we went for that diagnosis, again, because it meant that it's known that she's not going to say, oh, I am worried about X, Y, and Z, or I'm stressed about this. That what she'll do is kind of shut down and become really introverted. And we talk about it very openly at home and with friends and family and stuff as well. So she's well aware. We also have son who's 8, who isn't diagnosed, but he came home to me the other day and said, it's Autism Awareness Week at school, and my teacher was saying all these things, and they all just sounded like me. And I said, well, let me tell you that given that your dad has ADHD and autistic traits, I'm autistic, your sister's autistic, there's a pretty high likelihood that you're somewhere on the autism ADHD scale and spectrum. And he was all right with that. He was quite happy. So, okay, that all makes sense. For a bit more of a chat. And off he went to do his special interests. He said, oh, yes, I do have special interests. Yes, I like Minecraft. And I was like, yes, I know. So I think because we have a house set up in a very neurodiversity friendly way, because me and my husband are. It tends to be when when we have to manage outside things that it can be a little bit more difficult. But I guess as the years have gone on, we've got a little bit better at that. We know things like so a big family holiday coming up in August, and we made a choice to kind of book a villa rather than a hotel, because we know that we'll all struggle if we're with other people. And we, as a family, we were all like, oh, we don't really like other people, so why would we do that? Let's all go and book this villa. So that there's things that we've adapted over the years. If we go on a day out, we'll make sure, we'll leave lots of time. We'll make sure we've got kind of downtime the day after or something afterwards. So we've learned that over the years. They're all unfortunately heading towards teenage years and full of hormones. So I don't know how that's going to go. But that will be a new thing to kind of negotiate, and relationships and all those sort of things as that happens, romantic relationships. So yeah, I don't know how that bit is going to happen. That'll be interesting.
It's part of the adventure. It's great to have that it's great to have that understanding, though, of how your family works, and not trying to kind of shoehorn yourself into what people should be doing, because that's a nightmare. I don't know, Ken, do we have time for one more question there?
Well, we have to ask the chair that first, to be honest, I think.
Yeah, sure.
Okay.
We have time for one more. Yeah.
Okay. Just before we were just talking about neurospicy. I first heard that term last November, and we'd Claire Lee over from CERN. But she also was saying that that's for neurodivergent people. For us neurotypicals, it's neurobland.
I've not heard neurobland.
There you go.
I like that. Oh,
yeah.
I think people
so
get upset,
neurobland.
Get your start going, oh, but that's because you're neurobland.
Yeah. But for the question, and the reason I like this question, if I just frame it first, is that, we run support groups for adults and for women, and for the amount of women that comes to us that have been misdiagnosed for 20 years is incredible. So this one from Samantha, she says, thank you for sharing your experience. You've really hit home. I've been thinking that I have ADHD and or autism for a long while. You really pushed me to go to the GP to try and start the referral process. Now, any advice on what evidence to present for GPs solely to be taken seriously?
So with the GP, so when I went to the GP, because I'm autistic, I had got like a dossier explaining everything, not really taking into account that you have a 10-minute appointment and GPs are very busy. So actually what I would say is that you take key bullet points linked to kind of, you can pull the diagnostic criteria off, go, I do this, I do this, I do this. I'd like to be referred for a diagnosis, and this is why I think the diagnosis would be helpful. That is probably actually enough. GPs, they like nice, clear, concise information. And then it'll be when you do the assessment, actually, that you take your dossier of everything ever. And I think particularly if it's ADHD as well, obviously there is an option with medication with ADHD. So that might be something that, you can add that in as it's a treatment option. It means that you can, if you have a diagnosis, you can explore all those treatment options, whether you choose to take it or not. Yeah.
Okay, thanks. That was actually perfect there. 6 o'clock. Timmy, back to you.
Sure. Thank you, Ken and Beth. And of course, thank you to everybody who have shared in the questions and the comments, and so many affirming comments. And it's clear that, Victoria, your account has resonated with people. So as others have said, thank you so much for sharing so openly. Of course, we recognize that perhaps it's not easy to do so, and we recognize as well that there has been a lot of adversity in your experience, but you seem to have integrated that into something really positive to share and communicate with the world. So clearly, by doing so, you're doing a lot of good. So thank you for that and for being here this evening. You know, virtually in Ireland, but of course with people from all over the world really as well, joining and listening to the talk and receiving the recordings. So thank you. And I know we'll connect again via our nursing networks. But just to remind everybody, next month we have our Neurodiversity and Mental Health Conference, Shifting the Paradigm. That is Thursday the 25th and Friday the 26th of May. I may not have mentioned, but it's free, so there's no charge. Do come along and register if you can. It is, I think, rich in terms of the range of speakers and the diversity of the speakers and the topics to be covered. Our masterclass will double as a panel discussion next month, exploring neurodiversity and mental health in education settings, which, as we know, is very important for all the way from primary through to secondary or high school and tertiary, higher and further education. So please do consider joining us, and we hope you've had a lovely evening. And thank you again to Victoria Sweetmore for being here. Thanks, everybody. Good night. Thank you.